Okay, this is my case study. Resident A arrives to the SNF in the morning for rehabilitation. She is a Hispanic woman, 82 years old, who is 5 foot 4 inches and weighs 118 pounds. She has a history of type 2 diabetes, osteoporosis, heart disease, peripheral neuropathy, and stroke without deficit. She is alert and oriented to self and event. She disorients frequently, however, reorients easily. Throughout the day shift, resident A's blood sugar was relatively stable and ranged between 150 and 180. Resident A has routine insulin 12 units BID and a sliding scale of insulin before meals and at bedtime. The night shift nurse, who is a new graduate, recently finished with orientation at her facility, received report for her 30 patients. Of the 30 patients, 12 were diabetic and required Accu-Checks and insulin for the evening. The night shift nurse's medication pass took 3.5 hours to complete and was an hour and a half outside of the facility's policy for medication administration. During medication pass, the nurse received phone calls, medications from the pharmacy delivery, and answered all the call lights that the certified nursing assistants could not. During the morning medication pass, the night shift nurse administered patient A's routine 12 units of insulin without checking the patient's blood sugar level. Due to feeling overwhelmed and wanting to be compliant with the facility's policies, the night shift nurse administered the medication and moved on to her next patient. Patient A became sweaty, confused, and is unable to press the call light. Patient A loses consciousness. The night shift nurse discovers patient A unconscious. The night shift nurse reviews patient A's orders and then administers 1 milligram glucagon intramuscularly. Patient A regains consciousness. 911 is called, and patient A is sent to the hospital for further evaluation.